Hello everyone, hello dear students, hope that you're doing well and great. Today we're going to try to explain the most important lesson in physiology for the first year medical students. So this is the body fluid compartment. We're going to see how body water content and variation, distribution of water in the body for adults, and study methods, how we can measure the water in the body. The composition of compartments or volume exchange between these compartments and some special cases. This is an overview of our courses. So we're going to start by the introduction. First, before I read the introduction, we should know that our body contains a major percentage of water. So this water, it is distributed into compartments. We're going to see how we can measure each water in all the compartments by some medical tips and some calculation and some new terms you're going to see in it and the concentration of them. So first, the introduction. The most abundant constituent of the body is water, which contain variety of dissolved. Why we have a lot of water in our body? Because we have variety of dissolved, variety of substance, variety of solutes. It is distributed in the body in two compartments. The compartments are places or parts of body where there is water, and we name it by special names. Okay, so there is different compartments and a different place or part of water. So the compartment of water. So the volume, composition of and physiochemical properties of these volumes are normally stable. In normal person, which is not in case of disease or something like that, so the water in all the body is stable. The quantity of water is stable. So to maintain this stability, several mechanisms participates, constituting the hydroelectrolytes balance. We should know there is the electrolyte, which are the ions. Okay, the ions, we have cation, which are the positive ions, and the electrolytes, which are ions. They maintain stability by participating in this mechanism. So maintain the stability of the body fluid or the body water. This stability and the mechanism that maintain it constitute homeostasis, okay, which is stability of water inside the body. Body water content and variation. So we should know the total body water. It's like that, the total body water in healthy young adult, which is not sick, which is not in case of disease. Male, because there is difference when we have difference in gender, it's one of the factors. Female represent 2/3 or 60% of the body weight of 17 kilogram adults, which is 42 liters of water. So there is here some factors, because for example the age is play a major role in the difference of the concentration of water. For example, here for elderly, for a younger person, it's 60%. Also for the gender, it's 60% for the women. And there is also here other factors. For example, the fatty tissue, and these cases are not important. We should just know that in 17 kilogram, which is the normal adult person, healthy person, we have 16% of water, which is 2/3 of its weight, which means it's approximately 42 liters. Okay, this is the most important. Here we have like special cases, okay, because it's the water in the person varies depending on the gender, depending on the age, depending, for example, in the fatty tissue, and so there's different condition and factors. So here we can enter in the distribution of water in the body. Okay, the water is divided into the extracellular fluid or the extracellular compartment. We can write it like that, ECC or ECF. Okay, to not be confused, when we say the ECC is the extracellular compartment, here they are writing this in, let's just try to, okay, they're writing this in French, CEC, extracellular compartment. So the compartment extracellulaire en français. So the extracellular compartment or the extracellular fluid, because after that you're going to just see the extracellular fluid. And you're going to see where we have this F, what that means. It means fluid, okay? It's just simple. So it is divided, we have 60%, which is divided into extracellular compartment and intracellular compartment. And the intracellular compartment is just like EC or sometimes ECF, like that. Okay, so what is the extracellular compartments? Okay, or the extracellular fluid. The extracellular fluid is the water or the fluid which is in outside the cells. For example, here we have a cell and other cell here, other cell here. So this fluid between them is the extracellular fluid or the extracellular compartments. Okay, so nice. So we should know that the extracellular fluid, let's just try to, okay, just like that. So the extracellular fluid is also subdivided into two major divisions. First one is the plasma. Okay, let's just try to, okay, here I'm gonna add the paper to try to, here for example we have water, body water, total body water, total body water. We have seen that it's divided into the extracellular fluid and the intracellular fluid. Okay, this one is also subdivided into plasma and interstitial fluid. You see how here in the blood vessels, here we have a blood vessels. In the blood vessels there is some cells which are, for example, red blood cells, and there is fluid here which is the plasma. Nice. Okay, so this is in the blood vessel, and the interstitial fluid is in all the cells, either in all the cells but not the blood vessels. Here, for example, I have cell, other cells, there is a fluid which circulates here. This is the interstitial fluid. Okay, so nice. So let's return into our lesson. It seems like it's a long lesson, but it's just easy. Try to just follow me. So here we have 60% of total body water. It is divided into 20% for the extracellular fluid and 40% for the intracellular fluid or intracellular compartment. And when we try to count this in liter, it is here 40 liter and here 22 liter. Okay, just like that. It's so easy. The intracellular fluid is the fluid inside the cell. Inside the cell there is a fluid, there is a water. Okay, so this is the intracellular fluid. This is for the part 1 of the lesson. Let's see how we can measure this fluid in the body. There are many techniques used to measure. Scientific use many techniques to measure this fluid in the body and analyze and especially understand the volume of water. We have seen that the volume of water is stable. Okay, and the composition, it's composed from what? The water in our body is composed from what? This is so important. And the distribution of fluid in the body. This is also important. So they help determine compartments like plasma, extracellular fluid. Reminder, here we have seen the extracellular compartment is the same as the extracellular fluid. Total body fluid, using approaches such as dilution, tracers, direct sampling, imaging, or balance studies. Okay, these methods are not that much important. So you're gonna just try to focus on tracer or indicator dilution method. We have a lot of methods. Here in our course, we're gonna just see these methods. The dilution, or in Arabic, I'm gonna write it here in Arabic. Okay, This is like physical methods, dilution or tracer or marker, meeting the criteria and allowed to distribute uniformly within compartment. So we're gonna have here a compartment. Here we have tracer, okay, or in Arabic like that. This tracer we're gonna enter in this compartment, and after that, what do we have? Here we have the molar mass of this tracer. The concentration of the tracer is then measured. Then after that, after having this tracer which will enter in the compartment, I'm gonna just measure the concentration. The concentration of this tracer is then measured to calculate the volume compartment. It's like that. V is equal mc. Volume is equal the molar mass per the concentration of this tracer. It is used for measuring what? The total body fluid, the extracellular fluid, and the plasma volume, which is a part of the extracellular fluid. Here we have the principle of this method. These methods are reserved for specialized physiological studies. It's not like for medical use, it's just for studies. After the intravenous injection, we're gonna inject this tracer of a known amount. We know the amount of this tracer, which is big M, okay, of the tracer. The concentration initially rises. The concentration gonna rise, reaches a peak, then decrease irregularly, and finally enter a later phase when diffusion is complete. After the diffusion of this tracer in the compartment, we're gonna know how much this concentration is. From this, the original concentration can be determined, allowing the calculation of volume of the distribution. So we have, for example, we have here a solvent, okay? And we have a solute, which is, for example, X. This X, we know its original concentration. After putting him in this solvent, we will have all their concentration. It's like this is dilution, or in Arabic, attended. We have seen this in high school. Here we have C, مركز 1 2 مركز مخفف. After doing this relationship here for the original concentration can be determined, allowing the calculation of the volume distribution. Then after that, we're gonna just calculate the volume of the compartments. This is so easy to understand the study methods of body fluid. So this is the easier one, I think. Hope you understand this. So we have some criteria of the tracer. We're gonna use some tracers which are no toxic, easy to administer dose, not metabolized. We're gonna and the tracer which will enter this compartment is gonna be no metabolized or catalyzed and slowly eliminated by the kidney. So it's gonna not do some damage for the kidney, or it's gonna be hard to eliminate it by the kidneys. So we don't need this, okay? So then we have distribute quickly and evenly within the compartment, okay? Remains confident to the compartment being measured, does not change the compartment volume. This is so important criteria because we need to calculate the compartment volume, okay? So this marker can be either isotopic, radioactive, or no isotopic. For the isotopic one, we have a different tracer for all the different compartments. Here, for example, the first compartment, which is the total body fluid, we use the no isotopic and the isotopic, which are radioactive marker or tracer. Here we have the no isotopic ethanol, urea, antipyrine. Here we have to memorize all of them, okay? Because it can be in the MCQs questions. And the isotopic or the radioactive markers are the deuterium oxide, the tritiate water. Here we have the same thing for the extracellular fluid, the aniline, mannitol, which are no isotopic or no radioactive, and the radioactive one or isotopic sulfite chlor sodium. The sodium is so important Here we're gonna see how much is important. And for the plasma volume, we have the Evans blue. This is translation of the Evans blue, which binds to the plasma protein, so we can know the exactly volume of the plasma. We can use other isotopic markers like the albumin, which is also a plasma protein, is important, and diode. This is all for the first part. Here we shall now the extra balance sheet method. We have other method which is used in the intensive care. So it's medical use. It's really medical use. Okay. So first, what should we know? We should know that we have in our body some outputs and inputs. Okay. Something that's enter and something that's go out. So the water in the body is stable, okay? The water, the quantity of water is stable. So excellent. It is the daily comparison of water and electrolytes, the ions. Let's say the electrolytes is the ions to make it easy. Inputs and outputs and the measurement of its possible, if it's possible, or evaluation of gains and losses. It's less like how much you gain electrolytes and how much you lose electrolytes, how much you gain water, how much you lose the water. For example, here we have the input, the exogenous, oral, parenteral, endogenous. The exit here, or the outputs, are the urine, the stool, and the sweat. All of them, they represent like amount of water which exits the body. So it's like losses. How we can calculate this balance? The balance sheet is set 0 if the gains are equal to the losses. It is positive if the gains are bigger and superior for the losses. It's negative if the gains are less than the losses. So this method is used in the intensive care. So we're gonna calculate how much we have urine, how much we have sweat, how much we have all of them, how much we did metabolic to know if there is problem in water fluid, so we can add some for example serum or something like that in the intensive care. So this is so important in the medical use. Okay, what do we have here? We have the calculation methods, the method of expression of few physiochemical characteristics. So I'm gonna just try to divide the video into two parts. This one is gonna be for the second part. It's so interesting and so beautiful parts. Hope you understand the first part. So hope you have if you have some question, just tell me in the comments. Thank you so much. See you in the next part.